Welcome, medical students, to today's lecture on the intricate world of microbiology. In this comprehensive script, we will delve into various infectious diseases that affect the pediatric population. We will analyze the etiology, diagnostic challenges, and management strategies for each condition, focusing on the pathogens involved, clinical manifestations, diagnostic techniques, and treatment options. So, without further ado, let us embark on this enlightening journey. Neonatal sepsis, a serious threat to newborns, poses diagnostic challenges due to vague symptoms and limited communication abilities. We will explore common pathogens like Group B Streptococcus, Escherichia coli, and Listeria monocytogenes. Diagnostic difficulties will be discussed, highlighting the importance of blood culture, PCR, and other tools. In this section, we will explore the causes, diagnosis, and treatment of meningitis in children. We will cover both bacterial and viral infections and discuss diagnostic methods such as lumbar puncture and cerebrospinal fluid analysis. Additionally, we will touch upon antibiotic selection, supportive care, and potential complications like hydrocephalus and hearing loss. The TORCH complex encompasses several congenital viral infections, including toxoplasmosis, other infections, syphilis, varicella zoster, parvovirus B19, rubella, cytomegalovirus, and herpes simplex. We will examine the implications of these infections for pediatric patients, discuss their mode of transmission, and explore the diagnostic methods employed. Additionally, we will address the potential consequences of TORCH infections on newborns, including neurodevelopmental issues and long-term disabilities. Pneumonia is a major health issue in children. We will examine various pathogens, such as Streptococcus pneumoniae, Haemophilus influenza, and respiratory viruses, and their clinical presentation, diagnostic methods, and treatment. We will address the problem of antimicrobial resistance as well. While rotavirus is a widely studied gastrointestinal pathogen in children, we will explore a broader spectrum of pathogens responsible for gastrointestinal infections. From bacterial culprits such as Salmonella, Shigella, and Campylobacter, to viral and parasitic agents like norovirus and Giardia, we will thoroughly examine their transmission, clinical manifestations, and laboratory diagnostic approaches. Further, attention will be given to complications, including dehydration, malnutrition, and post-infectious sequelae. In healthcare settings, multi-drug-resistant infections are a growing concern for pediatric patients. We will discuss the prevalence, mechanisms, and management strategies for these infections, focusing on pathogens like MRSA and ESBL producing Enterobacteriaceae. Challenges in managing these cases will also be explored. Urinary tract infections, UTIs, are common in children, and accurate diagnosis is crucial to prevent long-term complications. We will unravel the diverse causative organisms responsible for UTIs in the pediatric population, including Escherichia coli, Klebsiella pneumoniae, and Enterococcus species. Diagnostic methods such as urine analysis, culture, and imaging techniques will be discussed in detail, alongside potential complications such as pyelonephritis and renal scarring. In immunocompromised children, invasive fungal infections pose a significant risk. We will explore the factors that make these patients vulnerable, such as prolonged neutropenia and organ transplantation. The common fungal pathogens, including Candida, Aspergillus, and Mucorales, will be discussed, as well as the difficulties in diagnosing these infections. We will also cover the appropriate treatment options to improve outcomes in this population. Viral exanthems, characterized by rash formation, often pose diagnostic challenges due to overlapping clinical features. We will explore prominent viral exanthems commonly occurring in children, such as measles, rubella, and varicella zoster. Differentiating diagnostic criteria based on the characteristic rash morphology, presence of Koplik spots, and serological tests will be emphasized. Furthermore, we will discuss potential complications related to specific viral exanthems, including encephalitis and congenital malformations. Tick-borne infections have garnered increasing attention in pediatric medicine. We will investigate the epidemiology and clinical presentation of tick-borne illnesses, including Lyme disease, babesiosis, and Colorado tick fever. Diagnostic strategies involving serological tests, polymerase chain reaction, PCR, and clinical manifestations will assist in timely identification. Treatment modalities and the importance of prevention strategies, such as avoiding tick-infested areas and proper tick removal techniques, will be highlighted. Cystic fibrosis, CF, patients are prone to various microbial infections due to impaired mucus clearance and reduced immunity. We will analyze the unique microbiological aspects of infections in CF children, including Pseudomonas aeruginosa, Staphylococcus aureus, and non-tuberculous mycobacteria. Diagnostic approaches, such as sputum cultures, molecular methods, and antibiotic susceptibility testing, will be explored alongside management strategies, including regular airway clearance, targeted antibiotic therapy, and infection prevention measures. In this video, we will explore the clinical presentation, challenges in diagnosis, and management issues of pediatric tuberculosis, TB. We will cover the unique aspects of TB in children, including the difficulties in obtaining respiratory specimens and interpreting diagnostic tests. We will also discuss the importance of preventive therapy and contact tracing for pediatric TB patients. Congratulations on completing this comprehensive study of infectious diseases in pediatric patients. We have discussed various topics, such as neonatal sepsis, pediatric meningitis, tick-borne infections, and pediatric tuberculosis. By gaining knowledge about the causes, diagnostic difficulties, and treatment approaches for these conditions, you are now better prepared to handle the intricacies of pediatric microbiology. Continue to broaden your understanding and contribute to the field of pediatric medicine. Thank you for your commitment to microbiology, and I wish you success in your future endeavors.